All right, welcome to another episode of Zero10 Podcast, where we have Andy, my co-host, and then we actually have Amanda Allmaras here today. And she's going to be talking a lot about health and wellness, but she's also just a down-to-earth, authentic human. And I think that's what we want to hear more of is just your story and your transitions and how you use, your gut to make decisions, like all the things. So I'm super excited to chat with you today, Amanda.
Well, thanks for having me. Yeah, like I guess I would say I just treat all my patients like maybe they're my sister, or maybe they're my grandma, or maybe they're my parents, and I just like to have such good relationships with my patients. Like I know about their family, I know about their businesses, like because I feel like you need to know those aspects of people in order to treat someone as a whole person. And I think if you're vested into them, you're going to treat them just like you know them better. So I'm a nurse practitioner by trade, and I worked in clinics for my first 10 years. And then I can't even remember. When did you guys do your first retreat, the Bismarck one?
It was in
Last,
March of 2024.
Okay,
last
so we had already moved then, but I came back for it. That's
Yes,
what it was.
yes.
And I
Yeah.
couldn't remember if it was before we made the big move or not. So 2 years ago, I finished clinic practice and we made like a huge leap of faith in our personal lives. And we moved like over 100 miles from Bismarck to, I call it the middle of nowhere. It's also known as President. I grew up in President, so it's not the middle of nowhere. My husband's from only like 30 miles away. So we're close to his parents, we're close to my parents. I have aunts and uncles here. He's got siblings in the area. So we're just much closer to family, which we both come from big families, close families. So it's been a good move in those aspects. But for me as a professional, moving to very rural North Dakota, I have the opportunity. I could open a clinic. I just didn't see that for myself. I had had dreams of doing one-to-one clients online for probably 5 or 6 years, but I worked in a clinic and I had those relationships. And I felt guilty that if I left them, that I would like be abandoning them. Like that was my true feeling. Like, and I couldn't like cope with that. Let's just be honest, because I like to please people. I know that. And so when we were moving, my husband's like, "You've talked about this for years. Like, here's your chance. Like, I think you should do it." And I'm a safety net person. I don't know. Are either of you firstborn girls in your family?
Yeah.
So I'm a safety person. I'm a perfectionistic and I'm a safety. So I like stability. So I always liked working for other people, knowing I was going to get paid on time, knowing what I was going to get paid. Like I liked being protected. Would you call it protection?
Yeah, security is, I get, yeah,
Yeah. And my husband's been on commission and he's the baby and he's a male. So he's a free for all, like fly by the seat of your pants, right? But anyway, so I had just opened a different business in Bismarck in January. And then I end up leaving my stability by October and moved.
yeah.
And so I started two new businesses that year. So it was exciting, but it was frightful. But I remember going to your guys' retreat and that force versus flow. And I think about it all the time.
Mhm.
Yeah.
And I talk to
I
my
do
patients
too.
about it all the time. And I'm
Hmm.
like, why am I fighting the inevitable? Like, why do we do that? Why do we make things harder just because we see this picture for ourselves, even if it doesn't make sense? And so moving to Fezzen, I went completely online. I actually started as a health coach because I didn't have all my stuff together. As a health coach, I wasn't limited, we'll say, to North Dakota, so I could help people all over the US, really. For the most part, all my patients were North Dakota based. They weren't even my old patients, which was fine, but they were mostly North Dakota based. And then, like, I have a strong care for women with like lipedema. And I was getting emails at least a few times a month asking me if I could see them, I could help diagnose them. And as a health coach, you can't diagnose. Like I knew, but like I couldn't be like, you have hypothyroidism. I'd be like, oh, I think your thyroid's a little off. Maybe we're going to support it through diet or nutrition, but I couldn't diagnose. Like those were my limitations. I couldn't prescribe if I wanted to. Those were my limitations. But those like lipedema ladies, like they're so lost and almost just written off by a lot of people. that I wanted to be able there to support them and to help diagnose them. And so I paired up with CC's physical therapy in Bismarck, and April's been great. And they see lots of lipedema patients. Beth sees like so many lipedema patients. So once a month, I try to go back to Bismarck and see clients in person. That's the only time I really see people in person. But it was honestly, I went back to my NP specifically for lipedema patients. I don't talk about it all the time, but um, and then I built my one-to-one programs prior to that, and I carried that on. And so my focus now has been the integrative side of medicine, and I solely focus on autoimmune and gut health and hormones.
And hormones. Yeah,
Yeah.
which you hit
So,
most things right there, honestly.
well, and that's what I say. If you're going to pick like one major thing to focus on, if you focus on someone's gut, you're going to fix so many different things.
Hmm. Right. Yeah.
Yeah. So I don't know if that was the
I
long version. If you want more in depth, you tell me what you want.
I remember way back in the day when I saw you as a nurse practitioner, and then I was referring my teenage clients to you with their skin. And I remember the first time that I remember the first gal that I think really like it was drastic. Her face was she's still my client to this day. I don't even know if she's in her 20s, mid 20s now, but she was
Oh my gosh.
13 and her whole face was covered with acne. And her mom kept bringing her in and I kept saying you need to go, and they weren't scheduling with you. I'm like I can't. There came a point where I'm like I don't even want to touch her at this point. And so I just said, until she sees Amanda, I don't want to touch this poor girl. And so they did go see you. And I think you put her on, I mean, I know you did, you put her on a digestive enzyme and zinc. And I'm not kidding. Like a month later, she came back in and she was completely, I mean, and it didn't work that way with everybody, but with this particular girl, all she needed was her gut balanced
I know
out. It
exactly who
was
you're talking
crazy.
about.
Yeah, because I think she's still, I don't know, she was your client then for, or your patient for many years, but she's still my client to this day. She's got beautiful skin. But
No.
I talk to, that's like when people come in, when people bring their teenagers in, most specifically, and early 20s, I don't touch them until we have a conversation about their eating habits, their health habits, things like that. And I can tell a lot of them I don't see again because that's not what they want. That's not what they want to hear. They want to hear that I can literally just give them a peel or something and their acne goes away, but that's just not how it works. Gut health, hormones, they're all tied to, skin, it's all tied together. As Josie, just the whole body. But for, in what I do, the skin, it's crazy what they can do with when their gut health is balanced, when their hormones are balanced, their skin is then automatically beautiful.
My gosh, it's so true. It is so true. I know exactly who you're talking about. And it's so
Mm-hmm.
funny because that's half the people I referred back to because
Yeah.
I respected so much that owning your own business, you were better than just taking that money in, that you
Yeah.
cared about your people and you said, I can't even help you until you help yourself. Like I completely and utterly remember that. And
Yeah.
like from there on, I'm like, oh, you should go see Andy because I
Right.
just
Because
respected it.
we can help. I can help with the scarring and the upkeep and the, skin barrier that's been a hot mess from, all the things that people tell them to do to the exterior. But anyway, um, just what you said about gut health. And, when you say it, they kind of, you can tell it, they'll roll, they don't, whatever, I don't know what they're thinking in their head, but a lot of times they don't buy into it from me until I refer them to someone with, that medical um, background. And then they see, so I love that that's your focus. I love that that's your focus because they're not hearing that from their
Primaries.
primaries, from their primaries. Yeah,
Like, I
absolutely.
think their only option would be is, do you want spironolactone? Do you want birth control? Which is unfortunate
And
because they
do you
will
want
help.
retinol?
They
Yeah,
will help,
they will
but
help.
they cause a lot of other issues that
They
get
can.
masked and we don't know it then because they have regular cycles and their skin is better. So everything else is falling apart, but they don't recognize it's from the medications because when a woman has a regular cycle, they're just like, everything's good. It can't be my hormones.
Right.
Right. Yeah,
Right.
for sure. So when did you know you were getting into more of a holistic side of your degree? I'll just say nurse practitioner.
So my background is I was a nurse, I don't even remember how many years, but now I've been an NP for like 12 and a half years. And when I was going back to school for my master's, because I'm master's prepared, I went to UND and Rhonda Jolliffe, who I know you guys both know, Rhonda was my instructor in NP school for my clinical rotation. And since once a month we had to meet, once a week we met in person, we only had one person from outside of Bismarck. So all of us would come to the clinic, and I just absolutely loved learning the other, let's say, holistic side of medicine. Because in school, you learn traditional medicine, you learn how to diagnose, you learn how to treat, you get a little bit of nutrition class, you get a little of it. Honestly, you're way well more prepared in nutrition going to chiropractic school than me as a nurse practitioner, or if I would be an MD. You are so much better prepared in nutrition. It's
Yeah.
outrageous. It's just honest. And so I was intrigued by that. And so then I get out of school. Rhonda offered me a part-time job, and I actually had a part-time job in the emergency room. Like opposite ends of the spectrum. Acute, emergent, urgent care, holistic medicine. And then a month after school, because I figured out how much stress messes with your hormones, I had fertility issues for 2 years going through school. And I don't feel like a stressed out person. If you know me, I'm pretty laid back. It takes a lot for me to get worked up. I usually manage a lot of different things, I think, fairly well, but internally, apparently, I wasn't. And I'd been to the doctor, I'd had my hormones tested. They say everything's fine. And the only reason they tested my hormones is because I'm asking them to. And I find out I'm pregnant a month after school's out. I get done with college and graduate. I was like, oh, look
Hey.
how much stress influenced my hormones.
Yeah.
And then I ended up just taking the part-time job with Rhonda. And so it led into full-time in no time just because we got busier and busier. And then I worked with Rhonda for 6 years, and then I had the opportunity to move over to a new clinic, and I ended up taking on like younger patients all the way down to like almost 2-year-olds. And so I just kind of expanded my practice over there. And at that point, I got to kind of work with a naturopathic doctor who was in the building too. So I got to see another end of the functional holistic medicine as well. So more muscle testing, things like that, that I hadn't seen. So I've actually been exposed to a lot of different areas. And I think it's just another tool in that toolbox for patients. I'm always say I'm just part of your aid. Like we have to have a team depending on what it is. I can guide you where to go, who to go, which avenue to go. And I'm not always the best avenue for people. And
Mhm.
so for me, I actually do free 15-minute phone calls to screen and go through and see what their goals are. And some people, I send them elsewhere. I'm like, I'm not the best person for you. I'll try to help you where you go. But just like Andy, like she's like, I'm not the best person for you at this moment. Who's to say I'm not gonna be later? But you know how it is. We can only help certain people. So
Right, for sure. Interesting. So I'm just curious, as you brought in all these different techniques into your tool belt and then had to process them through and decide like, how does this work for me? Or how did how did that change your life and maybe your perspective of what health means to you?
I think it's helped me understand I have to work on basics. I have to work on what am I putting into my body, right? What are we eating? Why am I eating? Is it good? Is it processed? Is it good for me? Um, I do supplements. I change them throughout the time depending on what I'm going through for my body and what my goals are for my body. And I do some testing on myself, you know what I mean? Like, I think this is good for this. Like, I'm going to try it as long as I don't think it's going to hurt me. it's influenced what I want to do for myself because I want my children to see what I do for myself. And
Mm-hmm.
so let's say 3 years ago, I did set a personal goal for myself. I was like, what can I do for myself that I would enjoy that I think would help me long term? And so I picked up exercising regularly again. And so for it's probably going to be 4 years in January, honestly. 4 years in January, I've actually been exercising regular again. So my second child, she's 11. So that was like 7 years of not putting any specific focus on myself because I had 3 kids under the age of 2 at one point,
Yeah.
and I was working full time, and I ended up kind of taking over the clinic temporary for a while because there was some medical concerns going on. Like I had a daughter in high school and activities, and life was complete chaos. And I would say, as a mom, you can get very easily lost.
Yeah.
And we
Yeah,
think we're doing good taking care of everyone else. And then the first one to go, I see a lot, is us.
Mm-hmm.
Would you guys agree?
100%. Yes, I see it all the time. I see, and I'm sure Josie does too, but I see women that will pay for their teenage daughters to have facials, whether they, and a lot of times they don't even need them. They just want them because it's a thing right now, right? That these girls think they need to anti-age. It's insane to me. But they'll pay for their daughters to get facials and they will not do it for themselves.
Mm-hmm.
I
I could see
mean,
that.
I mean, that's messed up in my head. I think that the mothers should be the ones doing that for themselves, right? And they all say, when my kids, when this, then I'll start coming in. And I get it. We put our children first, but there's just certain areas where, I mean, and Josie, Amanda, we know that that's backwards. We know that, right? We know that if we don't put ourselves first, um, you can't pour from an empty cup is what we say, right? But I absolutely see this all the time. Mothers all the time putting themselves last. And I'm guessing, Josie, you have to see it in chiropractic care too.
I say it all the time, yeah. And I would say one thing that I often say because, you know, babies have a really hard time regulating off of a stressed out parent.
Mhm.
They can't. I mean, they can, they regulate to them, but then we're doing the work in the room and, adjusting and doing our thing, balancing what we can. Then they're with them, 99% of the time afterwards. And so they're syncing with them. So it's really hard to get those results that they're bringing the baby in to get when they're not taking care of themselves. And when you have that conversation, I mean, it makes sense. I often say, okay, I'll scan you right now because I do a nervous system scan. So that I can about guarantee you the baby scan's going to match yours or your husband's, one of the two. You're here. Why don't we check to see if it's matching you? If it isn't, then we need to see if it's matching your husband. But that's just it. Like it's really hard to heal or to have like a healthy household when mom is not balanced. It's super hard.
And because I think you're with the kids the majority of the time in most households, not always, right?
Yeah.
Um, I have a psych NP friend, and she was over yesterday, and we were talking about the energies and how they pull off of your energy and your emotions and your responses. So I'm like, oh, well, my kids are a little crazy. I was like, maybe that is my energy, and I just don't even recognize it. And I'm like, huh, I better start self-reflecting a little bit better. But I think that's what you're kind of talking about is the energy that affects their nervous system and they pull probably who they're around the most and closest to, right?
Yeah. Well, and it's the same as like, um, where all these women, if they're like a basketball team, pretty soon they're all synced up to the same cycle, right? It's not because we interrupted it with pills or something like that. It's like the natural way things are. Like our nervous systems, my nervous system is syncing up with you girls right now by being here, right? So it's just yeah, it's that. It's very natural. It's very natural, but it's very energetic too. It's just we never end. Our little our systems really never end. They just kind of collide with the next person, these auras
So
and things.
do you do virtual visits now too?
I do
Coaching?
I do coaching this way. Yeah. Yeah.
So
Just virtually, but I know
we
that
were
that's possible.
talking about the computer yesterday, and I was like, I think the computer blocks a lot of the energy than if I was in the same room with a person because I don't, and it could be just my patient population has changed, but I definitely don't feel as drained emotionally from a lot of my visits.
Hmm.
Obviously, they're different. They're not acute. They're not really sick. I don't see a very high depressive mental health capacity like I have in the past because I saw a lot of mental health. And so that could be part of it. But do you think the computer blocks or protects you a little?
Well, I think there's some distance there, and I do think you could get really good at being empathetic through a virtual call as well. I think it takes practice. Just like I wasn't super great at it when I first started touching people, like adjusting people. I wouldn't say I wasn't worried anything about the person at the time. I was worried about me like performing the adjustment, right? So then, right. So eventually you start to like really connect with people in a different way. I do know this was really wild. I did a meditation, like a global meditation. This was a couple of years ago now, but he would, I could feel like it moved from one hand to the other as we were doing it together. And that was a virtual thing. So I was like, okay, so it might not be that I'm connecting through this screen per se, but there's something happening. I was like, I don't know, like, and he would kind of say there was like a noise that he'd make, but it was like a whoosh type thing. So I could feel it go left to right. Like I could feel it like whoosh through my body. It was the wildest thing ever. So then I'm like, okay, so virtual can happen. Like I can connect with people virtually, but I think I have to practice a little bit
Yeah.
because it is
Just like
different.
meditation, you gotta work at it to be able to get in that state and to feel it. Plus, you being a chiro, you have good senses. You know what
Yeah,
I mean? Does that
practice that,
make sense?
right? Yeah,
Yeah.
yeah,
Like I'm not the best touch person because I mean, I'm okay, but I don't do it all the time. And I don't base everything off of just my touch and like feelings. I actually probably have more gut intuition.
that's what I figured. Yeah, okay.
And I
Yeah,
think it's getting stronger the more I do it. And like I've learned that if it just keeps coming back or if the person just keeps coming back to it, I'm like, I have just realized we have to explore that because between the two of us, one of us is picking up something, and sometimes you just can't even explain it.
right, right.
Yeah.
And I think that's really cool that you say that because I think a lot of times, and people come to us, right, for advice, for recommendations, like, I want to get better, and they come to you to make it happen. But really, it's the patient that's doing the work, right? So,
Right.
like, that, like how you said, it keeps coming up, like for them, like I need to explore that. It's like you're not dismissing it. It's actually like them. It's how they can explain to you what's going on. Um, I think that that's dismissed a lot in patient visits of what the patient's actually feeling or
I
like
always I
yeah.
always explain that I like to make patients a story. Does this make sense? Like their life and their medical background, I make it into a story because we try to figure out where things went wrong or changed almost because we're really trying to figure out what built up to why their health is here. And so I think the longer you can listen to their story and ask them and inquire about their story, you can almost piece together this story. Because, like, I just had a lady, I have multiple people all the time that they just get a diagnosis because we want to diagnose. And if we can't diagnose, then you're fine, even though you have everything else in the world going on. And so sometimes you get a diagnosis and we treat it but they're not getting better with that diagnosis. And I'm like, well, then you should be getting better if we're treating the right thing. And I'll be like, let's go back in your story and timeline. And maybe it looked like this, but it really wasn't this. And
Right.
there are times all the time that, like, it's something else completely. It's close to it, but the treatment is very different. And so if you can just take that extra time, ask those extra couple questions, you can get them so much further because you're a little bit better focused on what they actually need to help them.
Right. Right. It's just like a little pivot in,
Oh my gosh.
and it
Yep.
can make a big difference.
And that's why, like, when I work, I do a lot of one-to-one programs, so it's over 5 months. And
Okay.
so part of that is I'm like in the clinic, why I changed it to do a program is in the clinic, I'd be like, okay, let's work on your hormones. Let's do a little chasteberry first. Let's see how that goes. And then I see him. I'm like, oh, come back in 3 cycles. We'll follow up. Well, what mom or daughter gets back in 3 cycles, right? Because all of a sudden now they're in basketball or they're chasing their kid for soccer or they got music concerts and things. And so they don't come back. They come back in 9 months and like, oh, I only did that for a month and then I ran out. I never filled it again. So we're 9 months down the road and we got nowhere with our hormones. So I
Yeah.
saw that as a big obstacle. So I like to, it's not even accountability. I like to be available and that we're going on a good time frame so that we can continue to see progress. And then I always say, if we start something and it doesn't work or you have a side effect, like I'm there, like I need to know. And I always say, we need to pivot or adjust right away because I would rather fix it than you just stop something.
Right. Yeah.
So do you require that they sign, like, do you have programs then? Is that what you're saying? Like they sign up for a 5 month or 6 month or whatever program versus just like, okay, I'll see you in 3 months and you just kind of hope that they come back.
So I pretty much all do programs. I have 3 different tiers for guts and for hormones. And so usually what we'll do is we'll do the free call. We'll talk about it. We'll see if we're a good fit for each other because sometimes we just don't mesh and it's just not going to work. Right? And that's okay. I've learned to not take things personally finally in my life, I think, most of the time. But I will do one-off appointments, but then I talk about, well, our goals are going to be different. I'm more of giving you guidance and advice and places to start because you're not guaranteeing that you're coming back to see me. So I'm like, our goals are very different, I believe. And that's kind of how clinic practice is,
Hmm.
like you have a one-off appointment here or there and you hope they come back to see you like they should. And so I feel like that's why we fail in getting where we need to be almost.
Hmm. Yeah.
So,
It's the long-term thing. Like it just is. You
well, in
gotta,
hormones, to hardly see anything, you need 2 to 3 months, right?
at least I would say.
And
It
then think
surprised me.
about gut health and gut healing. And
Yeah.
honestly, the nervous system is probably very similar. I would think I mean, you probably see good adjustments, but then you probably do continue to see long-term healing.
So, yeah, the brain scans that I do, it takes 3 months typically before, like, we don't even rescan for 3 months because it takes that long to start to see a shift in the brain. But we're talking neural pathways, right? So, yeah, it takes a long time. And they talk about how long it takes for a nerve to heal. The nerve is the slowest healing thing in the body, practically. I don't know if that's true. Don't quote me on that, but it's very slow, very slow. Like if you were to get a stinger and injure a nerve, like it takes a long time to heal if it ever fully does heal all the way. So yeah, when you're talking neurology, it takes time. It takes at
Okay, but
least a month.
I mean, and I get what I do is not as deep as what you guys do, not even close really. However, skin can really mess with people's their confidence levels and things like that. But the the pattern is 3 months.
Yeah.
And that's what I tell my clients too is like you're not going to get one facial and see results. I tell them 4 to 6, once a month for 4 to 6 months. But usually it's that three or third or fourth where they see results. And so I tell them, I always say, think about your diet, think about going to the gym. It takes the body time. You don't just eat a salad and the next day you wake up, and have lost weight. So I think I love that's kind of the theme here with all of our practices. And but how do you get people to truly understand that? Because I feel like when I talk to them about that, they nod their head and they go, oh yep, we understand, but they still wake up the next morning and go like, okay, well that facial was great, but I don't look 5 years younger. So how do you, you know, and I wouldn't say sell your programs, but how do you explain to clients, patients, with their, just so that they completely understand that they do need to commit? Because
Well,
is it easy buy-in for you, for you? Is it an easy buy-in? Are they like, oh yep, I get it, and they just commit?
some do, but I think some now have watched me for a while and I think they're starting to understand that things take time, but for a while it was like, well, why would I do that? And so you just educate. You educate on the gut health and you educate why. And then part of it is just being accountable. It's so funny as women, I would much rather not disappoint you, Andy, than disappoint myself.
Hmm.
Like, it's so weird. Like, we are
Yeah.
so mental. So I talk about that a lot. Like, you don't want to disappoint me over disappointing yourself because it's easy to disappoint ourselves because we do that all day, every day with all sorts of little things that we promised ourselves because we have so many thoughts coming through our head. And so, like, I will try to send them messages throughout here or there, or hey, you're due for a recheck, or hey, a quick check in, like, give me an update. Or I'm always like, if we start something kind of crazy, I'm like, check in with me in a week. I want to know how it's going. And I have people that pop in my brain all the time. And so if I have my computer around, my patients could attest, like, I will just send them the most random message. I'll be like, I don't know why, but like, I need to check in on you. And like, it's that subconscious. They needed something. And maybe they couldn't even get to the computer because they were down or they were sick or they were frustrated. And it was just like, it's just part of that connection, I guess. It is a hard sell sometimes, but I think the people who've always come to me have been through a lot of things, and I've always been a last ditch effort for people. Does that make sense? Like they've
Yes.
Yes.
done all the traditional, they've done all of that, and then I've been
Yes.
like that oddball out how I've treated my whole career. And now it's coming cool because everyone wants to do hormones now. And I was like,
Mhm.
oh, well, good, because I've done this for 12 years. And for a while, I'm like, am I doing it right? But honestly, I had the talk today. We were talking about breast cancer because I was like telling a lady who was in her late 40s, I was like, don't be so scared of the estrogen. They're actually finding that it's protective. And I thought back about my whole career and I said, in 10 years, I probably had less than 10 people get diagnosed with breast cancer on hormones. Probably less than five, honestly, that I was prescribing hormones for. I said, so my cancer risks were lower than the general population, and I have patients on hormone therapy all the time. Like,
Yeah.
there's something wrong with that. Like, that doesn't even make sense, does it?
Mm.
Well, it makes sense probably to us.
Yeah.
But
Yeah.
when you say hormone therapy, are you talking synthetic? You're talking natural? Like I know it's just such a popular thing right now. People are getting, you know, things injected into their bodies, all kinds of crazy things going on. So can you get a little more specific about what you're talking about?
So, out of all my years, I've always said I don't like oral estrogen. I don't like oral estrogen and I don't like progestins. And those are the synthetic ones. They build up in your system, they increase your clotting risks. They're hard to metabolize and detox. They get stuck in fat stores. Those are like the estrogen dominance, right? Um, a lot of times when you have your uterus, well, whenever you have your uterus, you're supposed to have progesterone no matter what, because it protects your uterine lining. However, progestin and progesterone are very different. And traditionally, we would say they're the same, and they're kind of the opposite. We give you progestins when we want you to bleed off your uterine lining, or we give you them sometimes when we want you to hold on to pregnancies. Like they just act very different. So I've always done natural progesterone, over the counter wild yam extracts, compounded creams, compounded capsules for progesterones. I haven't done a lot of prometriums, things like that in my career, and I've just seen people respond really well. Part of that is learning on the job, part of it was going to conferences, part of it was trial and error. As far as estrogens, I will do patches, transdermal, because you miss the liver on first pass. You miss a lot of those estrogen dominant symptoms. I'm working with one right now. Her estradiol patch actually has some soy in it, and she's sensitive to soy herself. So I'm trying to figure out all options there. And so it takes some time to figure it out. But that's the nice thing that you can do that for someone, or you can work with someone and be like, okay, ask your pharmacy this. I can do this, but I need to know this answer, or I'll look at package inserts. I looked at package inserts today on meds for food coloring
Mhm.
because
Mhm.
meds have all sorts of junk in them,
Mhm.
and we forget about that. So I like compounded bioidentical hormones. I like estrogen patches. I like over-the-counter progesterone, and then all women get progesterone, uterus or not,
Mhm.
Yeah.
because that is how you balance your hormones. I don't care if you don't have a uterus. I don't have to protect your uterus. I don't have to overload you with progesterone. I don't have to watch your uterus, but you need it in order to not go estrogen dominant, for one. You need it so you can sleep. You need it for your stress glands. You need it for water retention. You need it to calm you, to help you with anxiety. Like, women need progesterone. Like, that is the worst comment I think I've ever heard. You don't have a uterus. You don't need us. You don't need progesterone.
Oh,
We've had
where
progesterone our whole life.
so for our listeners, where how does your body make its own progesterone?
It's gonna come from your ovaries, and that's why when you shut down, your progesterone starts to decrease. But a lot of women, when you're on birth controls, I always say they kind of hibernate your ovaries. Your
Mhm.
ovaries don't have to think. So once you come off of birth control, a lot of people have fertility issues because their ovaries haven't had to do what they've needed to do for 2 years, 10 years, 15 years. And you remove a birth control and you just say, wake up, do your job, and then you're pissed when it doesn't.
Right. Yeah. Yeah.
And that's not how the body works. The body is like, it has to remember. So a lot of times I'll bridge them with a little supplement to help wake them up. Otherwise, the other thing your body does with progesterone too is when you're under a lot of stress, because who isn't? Life is stressful. Your body will do what's called the pregnenolone or progesterone steal, and it'll go to your adrenal glands to help with your fight or flight situations because it's
Right.
your calming hormone. So a lot of women are low in progesterone. Very rare do I test someone and I'm like, you have enough progesterone. Very rare. And so your progesterone starts to rise after you ovulate. So when the women are irritable, they're tearful, they're angry, they don't know how to control their emotions, they're getting all the PMS symptoms in the world, their cycles are shorter, they're heavier bleeders. Progesterone is typically your number one deficiency. And so it makes your estrogen dominance worse when you have a progesterone deficiency. If your progesterone was here, you'd be almost even balanced. But when you are stressed and it goes down, it makes all this significantly worse.
I've got a question, and it's just like one of those things that's in the back of my mind, and this could be completely wrong. Progesterone is made from cholesterol, right? Like
Yes,
you know what I
I
mean? That connection.
Yes, yes. It's called, if you look up the steroid hormone cascade. And
Yeah.
so I always pull up one and it's cholesterol, pregnenolone, and then it like breaks it down, right?
Mhm.
So then it goes over to DHEA, testosterone, and then all the estrogens. And then over here it goes to progesterone and then it goes to the adrenal pathways. So it's hard to hold it into there. So it's the steroid pathway, I think, is what you could look at it. I always Google hormone conversion chart, and that's the one I pull. But what I learned was vitamin D is actually your precursor to your cholesterol. And so living in North Dakota, being
Yeah.
vitamin D deficient or not converting or utilizing it, we're already at risk for hormonal issues. But yeah, I learned vitamin D because it's a steroid hormone, right? Call it a vitamin, it's a steroid hormone, cholesterol, and then cholesterol breaks down into all your hormones.
Yeah. I just feel like when you start looking at hormones like that, and people start digging in, okay, so this, I don't know how much time we have, but then we start talking about statins and cholesterol and like all these things that we're like, we're all, those things are all affecting our hormones later on too, or like the anti-anxiety meds and those things that are really affecting that whole cascade. And then we're down to the progesterone at the end, and it's like it's not enough, and because it's not. But
Yeah.
it's like there's such a mess all above it, it seems like too. How do
I
you?
think it's going to be interesting now that like there's such a move for like hormone replacement right now. So this is what happens with women and cholesterol. We don't usually see a typical risk until they hit their like 60s, right? Heart disease doesn't start coming. Well, you're 5 to 10 years past menopause at that point. So estrogen is cardiovascular protective. And so women usually have like amazing HDLs, great good cholesterol, and pretty darn good LDL, right? So as our estrogen drops and we start aging, our LDL starts creeping up. So then we get put on those meds. Whereas honestly, if you just went on some estrogen and held your estrogen level there, I bet there actually I saw a study. I think it's a 60% reduction in cardiovascular disease is what they came out with if you actually go on hormone replacement therapy. 60%.
50%.
It just came out. I forgot I read it the other day. But
Interesting.
like,
Yeah.
and that's just in that test. So who knows what their other risk factors were? Did they smoke? Were they overweight? Did they have a family history? Do they have high blood pressure? Like, there's so much into that.
Yeah.
So I honestly, I theorize that if you go on hormone replacement early, if you're not at high risk and you don't have genetic risks, right? Um, I bet your statin risk and the need for a statin is going to be much lower. I just had the talk yesterday. The lady's doctor wants her to go on a statin. She's like, "What do you think?" And I said, "Well, I think you went from normal thyroid to hypothyroid, and thyroid plays a big role in cholesterol. I would test your full thyroid and treat your thyroid before I do a statin."
Yeah. Right. Right. What would be your top? I'm gonna say three, but if you have more than three, that's fine, or less than three, that's fine. But tests that you should do annually, like every year, um, to have a good baseline to just to check your health versus just a regular blood panel, because I don't honestly don't feel like that does a whole lot for us.
We do insulin A1C
Okay.
because that's going to be your metabolic risk, your heart disease risk, your diabetes risk. But as your insulin goes up, your inflammation goes up as well. And if your insulin goes up, you're going to have more testosterone hormonal issues too. So insulin is like an actual really good marker that
Yeah.
doesn't get tested a lot. I tested a lot on hormones because I think PCOS and insulin resistance and things like that. Um, Another good marker, honestly, probably vitamin D because it affects all your hormones. And we live in North Dakota. And so, two people in my career now, I just had my second one the last month. I told them to cut back their vitamin D. Two people in my entire career have I told them to cut back vitamin D. So,
Oh,
typically, you're not going to overdose on vitamin D.
yeah. Are you seeing people
One,
start to take that vitamin D more and more? That they have to. I feel like it's something that is continuous. Like like people are always having to. Like, is there a reason behind that we're missing
um,
in
I
our?
looked it up and well, there's a genetic issue. It depends on if you have the right gene to have the enzyme to break it down. Okay. So even if we're outside and in the sun and we have a good tan, sometimes those people are vitamin D deficient and they're like missing the enzyme to break D2 down into D3 to make it active. And
Interesting.
so that's why in the clinic, they used to, well, they still prescribe. I've never done it because I've never seen it work. They prescribe 50,000 IUs of vitamin D2. It's a prescription one once a week. So 50,000 sounds like a lot, right? I never saw anyone's levels change more than probably 5 points. And
Really?
so I would do 15,000, 10,000, 5,000. Take with food because it's a fat soluble vitamin. And their numbers they would change more than ever before. And
Okay.
that was every day. And now what I do is oh, what is it? If you Google vitamin D calculator, shout out to Beth Sanford because that's all she studies, and she's a nurse in North Dakota. But Grassroots has a vitamin D calculator on their website. You can put in what your level is, what your goal is. I say 60 or above, how much you're taking, how much you weigh, and it'll tell you what to load with and what to maintain with. How much?
Really?
And it's crazy. It's like 25,000 I use for like 10 to 15 days every day to
Mhm.
boost you. And the benefits that people have when they add their vitamin D back in and they get adequate, it itself is amazing. Plus, it's anti-cancer, antioxidant, helps your hormones. Like, it's
Yeah,
honestly endless what vitamin D can do for your health and wellness.
right,
Mhm.
right. No, very cool.
Um, I don't know about a last one. I'm
That's
just
all right.
trying to think.
That's
Yeah,
fine. Are you testing with mostly Dutch these days for hormones? Are you doing
I
something
don't
different?
actually do Dutch.
No more Dutches. Or maybe you
I
never
don't
did.
I don't do much Dutch. Unless people come in and ask or inquire about it. I actually don't do much Dutch testing because Dutch is a byproduct metabolite testing. It's not necessarily how much you have always, it's more of like what you're excreting because it's a urine byproduct. So it's more of a pathway of how you detox your hormones. And
Mm,
so for me, I usually based off, are they a good estrogen detoxer or not by, do you have endo? Do you have cysts? Do you have heavy cycles? Do you have fibrocystic breast? More by like the symptoms that are caused by it. So
mhm.
I have not done a lot of Dutch. I will
Yep.
do either blood testing or saliva typically.
Nice. Good to know.
Not saying I don't do it, but it has to be very patient specific.
Yeah. Yeah.
Yeah.
Great. And that's you do have, I know we're running out of time here. I'm so sorry, but you have the Labs Your Way. Can you talk about what that is for the community?
Yes, yes. So in Bismarck, it's going to be 3 years in January. Jill and I open Labs Your Way, which is wild. So it's a cash pay lab, kind of similar to like an Access or a LabCorp if you're out of state, because North Dakota is very slow to get things, right? Especially franchises. And so I saw a need. I didn't know as a nurse practitioner the cost of blood work.
Yeah.
And I like blood work. Like, I think bloods and labs gives us insight to all sorts of things. Like, I do like blood work. And I had one patient come back to me. She's like, "Oh, I'm so glad we got some information. Like, that was kind of expensive." And I was like, "It was?" Like, I had no clue, probably for 5 years of ordering blood work, what an actual thing cost. And so I've always had an idea of opening a lab, and Jill is by far the best person in the world to have there. She's friendly, everyone loves her, she's got the greatest laugh. She is probably the best blood drawer you'll meet too. And she's got good knowledge background, and if she doesn't know, she calls me. So I actually got to take what I do and I created panels and they had some panels and we have custom built panels and we have them all organized between autoimmune, rheumatological, we have hair loss, we have hormones, we have wellness. We just have such a vast variety. You don't need a provider order. We will take one. You can schedule online, you can call. There's really no wait because you have your appointment time. Um, yeah, it's been, I think, a really good benefit to the community. She goes up to Hazen a couple times a year. We're looking at doing some other outreach communities in the next year, and it's been good. And Jill is amazing.
Oh, fun. Well, that's awesome. Really neat. Where do you see yourself in 5 years? It's still your
I
question, Andy.
I so I haven't set out my long-term plans. I'm going to another conference. You guys started like this like whole like self-reflection thing for me after the retreat. And I don't like public speaking. So then I got invited to speak at the You Flourish conference in Harvey last year in their satellite spot, and they invited me back. So I'm going back in January. But that was a really good goal setting one. I am still looking at your retreats. I've actually looked at your dates, but we have a wedding and then we have something else on a couple of those months. So for me to travel more than once a month somewhere far probably isn't going to happen. But in 5 years, I honestly hope that I can add a functional like dietitian to my practice, probably because they're better at it than me. And I feel like nutrition is something that we're lacking. And how do we get there? And how do we do it in rural areas? Because moving rural and my access to food and good quality food, or even just produce,
Yeah.
dramatically change. So for me, it would be adding on. And I honestly think I want to start creating some online classes so that people can kind of self-learn.
Mhm.
And then it would lower that cost and it would open up some of my knowledge base to other people because I'm like, wow, I have a lot of experience. That must mean I'm getting old.
Not true,
When
but
did
you
that
do.
happen?
Wise, wise. Awesome.
We love what you're bringing to our area, and like you said, you can have clients anywhere, patients anywhere, but we really appreciate you so much, and thank you so much for being on the podcast today. Josie, anything else?
Only thing is, how can people get a hold of you and connect with you?
You can follow me on social media, just my name. I don't even go by my business name, so Amanda Allmaras. I'm on Instagram, I'm on Facebook, and then I do have a website. It is amandaallmaras.com.
I love it.
Because I figured nobody would know my business name and everybody knew my name. So I just started with that.
I
Yeah.
love it.
Perfect.
Well, thank you so much for having me. It was fun. It was so good to see you both too.
Thank you. Good to see you too.
Bye.